Narendra Modi, COVID review meeting. PM Modi holds review meeting as COVID cases surge in India. India News, Times of India. New Delhi, Prime Minister Narendra Modi held a high-level meeting on Wednesday to review COVID-related situation and public health preparedness in view of the recent surge in coronavirus cases, as well as influenza infections. Union Health Ministry. Bulletin, India recorded a single-day rise of 1,134 COVID cases, the highest so far this year. The active cases have increased to 7,026. The death toll climbed to 530,813 with 5 fresh deaths. The daily positivity was recorded at 1.09%, while the weekly positivity was pegged stood at 0.98%. Meanwhile, cases of a new subvariant H3N2 is increasing as the virus is quickly spreading across the country, and its cases are also coming to the fore. Apart from top Health Ministry officials, the meeting was also attended by Home Minister Amit Shah and Civil Aviation Minister Jyotiraditya Scindia, said sources. Revised guidelines. On March 19, the Health Ministry had issued revised guidelines for COVID-19 in the wake of the surge in cases. Antibiotics should not be used unless there is clinical suspicion of bacterial infection. The possibility of co-infection of COVID-19 with other endemic infections must be considered. Systemic corticosteroids are not indicated in mild disease, revised guidelines said. The revised rules highlighted the need to maintain physical distancing and use masks. Seek immediate medical attention if difficulty breathing, high-grade fever, severe cough, particularly if lasting for more than 5 days. A low threshold is to be kept for those with any of the high-risk features, the guidelines read. Additionally, in moderate or severe diseases at high risk of progression, the guidelines recommend remdesivir for up to 5 days, 200 mg IV on day 1 followed by 100 mg IV OD for the next 4 days. Letter to 5 states. On March 16, the Union Health Ministry had written to the state governments of Maharashtra, Gujarat, Telangana, Tamil Nadu, Kerala and Karnataka to follow a 5-fold strategy of test, track, treat and vaccinations as these states witnessed a rise in COVID-19 cases. There are a few states which are reporting higher number of cases indicating possible localized spread of infection, and there is a need to follow a risk assessment-based approach to prevent and contain the infection, without losing the gains made so far in the fight against the pandemic, Union Health Secretary Rajesh Bhushan said in the letter. Bhushan advised the states to examine the situation of COVID-19 at micro level and maintain focus on implementation of necessary measures for prompt and effective management of the disease, duly ensuring effective compliance with various advisories issued by the Ministry of Health.